All right. So good afternoon, everyone. Today I have the pleasure of hosting two panelists, Sue and Hans, both from Qualicum Beach, and we are going to discuss the family doctor shortage on Vancouver Island, and that is all. So we'll get right into it. The family doctor shortage in Vancouver Island, as I'm sure most folks are aware, is I would say in a very urgent at a very urgent point. It's been talked about for years, and here we are now, seeing, it seems almost weekly, stories of clinics closing and doctors retiring in our local news. So if you two wanted to share your thoughts on that, if you could just talk a bit about your own experiences or experiences of friends and family members trying to find a family doctor or access healthcare on Vancouver Island. That would be great. So maybe Hans.
Yeah, sure. My name's Hans Hendricks. We moved to the island here in 2019. We were on the lower mainland for 25 years before that. When we came out, or before we moved, we actually checked and we did a Google search, and we found yellow page entries saying that there were several walk-in clinics around the area, because obviously we were leaving our family physician behind. And between Qualicum and Parksville, there were various walk-in clinics. So we assumed that our needs would be at least initially met. Now, the day we moved, my wife actually injured her knee. So the very first day we were here with our furniture, I got on the phone and started calling around. And I discovered that all of the walk-in clinics in our region here, our area, had all been closed down, with doctors retiring, doctors disappearing. So I started calling actual doctors' rooms, and happily, one of the receptionists said she'd heard of a doctor who had rooms out in Bowser once a week who was actually taking patients. So I called them, and I left my name with them, and they called us back a week later. And happily, we found a family physician fairly quickly. Now, his rooms in Bowser, I think the lease ran out. So then we used to have to drive out to Courtney, where he had rooms. And then he built a beautiful clinic out in Cumberland, where he was there with another doctor. And we went there a couple of times. And then at some point after the COVID epidemic started, he was off for health reasons, and we wondered if he'd actually got COVID. And sometime later, I needed a doctor's visit, and I was sent to his partner, and he was great too. And then July last year, we got a letter from the practice saying that due to health reasons, they were closing down, and they had no recommendations other than we should get registered with a health registry. You know, there's the 811 number, and you can register online if you're waiting for a family physician. So that's what we did. And since then, we've had to make do with the TELUS, you know, the MyCare facility. So there is no GP taking patients, to my knowledge, anywhere nearby. However, when it comes to renewal of prescriptions and things, you can actually register with the TELUS My Health, or TELUS Health My Care, I think it's called officially. And you can get a small application on your phone or your iPad, and you can type in your medical history, and you can request an appointment on there, and they will actually set up an appointment with an MD. And in my experience, it's always somebody different. You know, I've never had the same person twice. And they're able to do stuff like renew prescriptions. You put in what your prescriptions are, and they'll chat to you and determine that it's reasonable that they do that, and they do it. But obviously, they're very limited. You know, if you need somebody to look in your ear or to examine a mole, you're out of luck. And they say, well, your only option then is to go to a walk-in clinic. And to my knowledge, the only walk-in clinics anywhere nearby, I believe there's one in Nanaimo and there's one in Port Alberni. And I've never been
Yeah.
to either of those. But I know I've on Facebook, I think on one of the posts, someone was saying, yes, they'd been to the Nanaimo one because they needed a prescription renewed. Um, and they were there at 9:45 in the morning, and they were seen at 2:30 in the afternoon. So those clinics are obviously under siege to the point of being pretty much inaccessible, other than to people who are prepared to go and camp out there the night before in order to ensure they get seen. So outside of the clinics, I mean, what are our options? Is really just to go to the emergency department in a hospital, or to go to the urgent care center at Oceanside in Parksville. And both of those, I am led to believe, are more for emergency care. So if you go ahead and have a heart attack, then they'll take care of you. But up to that point, you're pretty much on your own. And it seems to me that, especially with an aging population, ongoing care is the only way to prevention of serious afflictions, right? So you need somebody who knows your medical history and who knows your instance and who will trigger the appropriate things to happen at the appropriate time, especially as you get older and are less able to advocate for yourself in these things. Like at the moment, I make sure I get copies of everything, and I keep my own health records because nobody else has them. And it's up to me to decide when I need to get my cholesterol checked or my blood pressure or whatever else may need checking, because there's nobody in the world that is looking out for me in that regard. But it concerns me that as I get older and become less able to do that, there's nothing to fill that void. Now I realize that it's a free service, or it's said to be a free service, but I also know that it constitutes a significant chunk of the taxes we pay in our lifetime. And I've been dutifully paying my taxes for, since the first day I arrived in Canada, 28 years ago, on the understanding that even though I didn't need the medical services much up to this point, as you age, as you get older, your medical requirements increase. So I've been paying into a system, on the assumption or in faith that that system would be available for me when I need it. And I find now that as I'm getting older, the system is not there. There is nothing. There is a void where, that system is. Now, imagine that you pay into the CPP, the Canada Pension Plan, for 40 years, and then comes the time to draw. They say, sorry, we got no money for you. That certainly is cause for complaint. And I think this absence of medical services is exactly the same thing. That I've done my duty in contributing to that system over the years. And now when I'm getting to the stage of my life where I actually need repayment to those contributions that I've made, there is nothing there. And I think that a lot of people find themselves in this position. I heard somewhere that there are 5 million people in Canada who don't have a family physician. I know that there are over 5,000 names on the healthcare registry just for Qualicum. Qualicum and Parksville, right? So out of a population of what, 30,000, 5,000 don't have a family physician. So that's 1 in 6. And that matches pretty much the situation in Canada as a whole. And to my mind, that's a critical situation and it needs attention. But it doesn't get attention because it's a political hot potato. The obvious thing is to spend more money on it. But the government, to my knowledge, already spent, I looked up, I think last year, the Canadian healthcare system cost something like $308 billion, which is 12.7% of our gross domestic product. So the last thing they want to do is put more money into this thing. And that's the easy solution, which means that the solution has to be significantly more nuanced. And in order to get any change or any development in this area, there has to be a political will to address that. It's hard when you're powerless in the system, which is what most consumers of our medical system are. Is by and large, we're powerless, individually powerless. So the only way to get change here is for us jointly to exercise the kind of pressure on politicians that makes this an election issue, to makes it a political issue that they cannot ignore, right? Because any change that happens has to come from the top. Anyway, that's a long speech. I hope I haven't put anybody to sleep here. So, Sue, over to you.
Thank you,
Well,
Hans.
I don't know what.
Quickly, I just thank you, Hans. I think you really touched on a lot of key issues, so we'll definitely come back to some of those. And please, yes, over to you, Sue. It'd be great to hear your experience as well.
Well, I don't know what to say after Hans. He just hit the highlights. I just find that I've been in Qualicum Beach for 13 years now. And during this time, I've gained and lost several doctors, mostly because they have had to move away or one's passed. Another one lost his license. He was not a good doctor, but I was appointed him. I consider myself lucky to get him. And then I got one that was really bad after that. So, now I'm really lucky. I have an awesome doctor. I trust him implicitly, and I feel blessed for that. But some of the doctors I've worked with, I haven't trusted them, but we had no choice who we saw.
Mhm.
And that's not right. But if we have a medical shortage, what can you do? But when they brought in the Oceanside, or sorry, the urgent care center, prior to that, we were supposed to get a hospital. They've been talking about that since before I moved here. They keep saying, we have a very elderly population. I think the median age is 67 or 68. And that means we have higher incidence of health needs. And without having doctors and a hospital nearby, I mean, the nearest hospital is 45 minutes in one of three directions. But if you get to the hospital, you can expect to spend 4 hours minimum in emergency waiting for help. And this was before COVID. I don't know what it's like now. But you can imagine you're in pain, you're suffering, and you're spending 4 hours waiting to see someone. So, but at any rate, where am I going with this? I think the important thing is we need walk-in clinics, we need more doctors, and we need our own hospital. And the urgent care center is not a walk-in clinic. They can't treat most of the things you would go see to a GP for. And so my father, who is 87, has recently moved to the island so he could be here, so I could care for him as needed. And he can't get a doctor here at all. We were told that if he needs renewals, he can phone his doctor from the interior where he was living. And he had a problem. We went to Oceanside Urgent Care, and we were told, no, sorry, we can't help you with that. So what do you do if you need physician help? But they won't help you. And originally we had a walk-in clinic in Parksville. And when urgent care opened up, they forced the Parksville walk-in clinic to close because they said, we're filling that mandate now. But unfortunately, they had a hard time with staffing. And so they closed that. And then they tried to pressure the previous walk-in clinic to be a walk-in again, but they'd already changed their focus. So they weren't willing to do that. So now here we are. The nearest walk-in clinic is Nanaimo, and apparently there's one in Port Alberni. But as Hans was saying, go there in the morning and not be seen till the afternoon. That's unacceptable. It really isn't, because we don't pay BC Med anymore, but we did out of our own pockets for decades. And what do we have to show for it? I think a big part of the problem is there's only allowing so many medical students. By the time they get out of school, they're so far in debt, they can't afford to open a practice. So then they do work for something like the TELUS eHealth or My Health or whatever it is, so that they don't have to open an office and pay staffing and get all the equipment and whatnot. But I imagine it's really frustrating for these newly graduated doctors. So I don't think I have anything else to say right now. I hope that helps.
Yeah.
Very much.
No, that's
Thank you. Over to you.
yeah, that's great. And Sue, I can recommend TELUS for your dad. If all he needs is prescriptions renewed, it's actually very convenient to just get the application, make an appointment, explain what you need, and then they send you an email saying where do you want your prescription to go, and you just point them to your pharmacy. So it's
Right.
it's at least that aspect is pretty well covered by TELUS Health. But
Yeah, well,
you're absolutely yeah.
For now, his GP in the interior is looking after him that way.
Yeah.
But just like with TELUS My Health, they can't, if you've got a problem with your foot or your wrist, they can't help you.
Yeah. But I think the other thing you touched on, I think, which is very valid. Well, there's two things you touched on. And the one is that there are not enough doctors. And I think there are two causes for that. And the one is that we have basically a free health system. Now, anybody who knows economics knows that demand is a function of price. As price goes up, demand drops. And as price goes down, demand rises. And when you have a free system, then demand is limitless on that system. So the only way that they can control cost on the medical system is to control the supply of medical services, right? And this is why they ration surgeons in terms of their operating theater time, so that they can only do so many knee replacement operations a month. Because if you gave one orthopedic surgeon free reign in an operating theater, I'm sure he could do 60 knee replacements in a month, and that would cost a fortune, right? That would cost the system too much. So they control costs. And I believe, Adrian, that one of your callers in your previous podcast actually mentioned this as well, that they very rigidly control how many people they allow into the systems. And once it's in the system, they control how much you can actually bill, right? So specifically for hospital time and surgery time and technical time. Now, the other part of that is that imagine that you had an unlimited supply of family doctors. You're getting youngsters graduating every year out of university, and you're absolutely right, Sue. So you come out of university and you've got $120,000 of student debt. Now they want you to go to Qualicum Beach and sign a lease on a property and buy furniture equipment and employ staff, right? And potentially a receptionist and an accounting person, and then you need to stock a dispensary
Insurance.
with some stuff. You have to have litigation insurance and medical insurance. And now you can start seeing patients. And of course, with our waiting list, you would be immediately inundated with 3,000 patients, which means that nobody gets an appointment in anything under 3 weeks. So you don't get to deal with anything interesting or critical. Everything is routine. And you get $30 a consultation. So now you've got to see 6 patients an hour in order to generate $180 an hour of revenue. By 8 hours is what, like $1,200, $1,300 a day. And for that, you have to pay rent, you have to pay insurance, you have to pay 2 or 3 other staff, and you have to try and make a go for it. You'd have to be crazy to volunteer for that. And that's why I think doctors pack up. It gets to a point where they say, well, why do I need to do this? I know my doctor on the Lower Mainland sold his practice, or he'd left his practice, and I asked him why. And he was actually a South African, and he said he'd gone on vacation to South Africa for 4 weeks with his wife and his 2 daughters. So he had to pay airfare and expenses. And he got back after 4 weeks and was presented with a bill for $13,000, which is his share of paying for his practice. Right? There were 5 or 6 doctors in a double-story building, so it really is not very viable, or certainly not very rewarding to be a family physician in BC.
I
Okay,
agree.
so that's the problem. So how do you resolve that? And I'm guessing the only way would be for the government to set up clinics, something like the urgent care center, where they employ doctors, or they cover the administration and the premises and allow a doctor to become an employee of that organization, much as TELUS Health does. In other words, if TELUS Health was not only a virtual service that you access over the internet, but if they had clinics where they had young doctors, each one was given an office, and TELUS employed, or TELUS Health employed, the receptionists and did the bookkeeping for them, then suddenly it becomes viable, right? For a general practitioner to work without the stress of having to try and be an entrepreneur and run a business at the same time.
Yeah, it becomes viable for the practitioner, but what about the company? And that's why I think the $30 per consultation has been the amount, I think, for 20 years or maybe longer.
Really?
And yeah, so I mean, you have wages, so MOAs, you have your MOAs, litigation insurance, all these costs continue to rise, leasing costs, or the cost of the commercial property itself, if you were to outright buy it. So How would either of you feel about a parallel private model, or perhaps a parallel private model that maybe, you know, didn't cover everything, but just a piece of it, if the government were to offload a piece of or does that open the gateway to full privatization? And I feel as Canadians, it's almost sacrilegious when we mention the words private healthcare, but I'm just curious, I guess what both of you think. Is there any potential for private healthcare to run in tandem or independently of the public system to kind of offload some of that pressure on the public system?
Definitely. And for many years, I paid for my own private doctor to deal with a health issue I had. And he was the only one that understood. And I paid for every one of my appointments. I also have a naturopath and I pay for that too. So yes, there is. And we pay for our dentists and our eye doctors. And, you know, I think if it would help relieve some of the wait times and the pressure that our GPs are going through, then yeah, I think those that could afford or those that were desperate would definitely jump on that.
And I think if they can, I mean, if you think about that Dr. Robin Day, who had the surgical clinic in Vancouver, and he was doing knee operations and arthroscopies and things, and how he's been pursued in the courts over many years to try and force him to shut down. And of course, that's a political issue because he threatens the monopoly, and there are significant political interests through the unions of the monopoly of medical services. But I think I'm not in favor of having. Well, I'm in favor of offering people a private alternative for things like surgeries. Like if you don't want to wait 6 months or 12 months or 18 months for your knee surgery and you have the means, by all means, go and pay somebody to do it. I mean, your alternative is to go over the border and have it done in Bellingham, you know, or in Seattle. Okay. And that's a win-win situation because you get your surgery quickly. But for everybody else, it gets you off the waiting list. So the waiting list over time would get shorter. Plus, of course, that expense is no longer borne by the government system. So that knee replacement is then available to somebody else down the line. So I think that that's not a system without merit. I think to relentlessly pursue all alternatives is to some degree immoral when the authorized system is so incapable of addressing people's needs. Okay, the other thing, I think, the other aspect to that, I think, is that given that the medical system is relatively expensive, and Canada has, I was reading, has the second most expensive per capita medical system in the Western world after the US. And if you look at countries like Denmark or Sweden or Norway or Holland, they all offer, you know, centralized medical systems and all at significantly less cost than ours. And I think that part of the problem is systemic here, is that I think a lot of the funding is leached off by the trivial, right? Have you ever been to a physiotherapist or had been referred to a physiotherapist who hasn't immediately scheduled 12 treatments for you, which is, I believe, the number that the medical services plan covers? Now, I don't begrudge anybody a living, but the cost of those to the medical services plan adds up, and to the point where I think a lot of trivial medical issues absorb the bulk of the funding. And I've often thought if there was some cost involved for the patient, right? If you go to a physiotherapist and they prescribe you 12 treatments when really they could have done it in 3, you go along with it if it's free because you trust them, or you believe that there's no harm done in the additional treatments. If it's costing you $35 a throw to go there, there's at least some sort of inducement on you to constrain the amount of medical services that you consume. Now, that sounds un-Canadian, and I'm sure it would have to be leavened somehow with some sort of means test. If somebody doesn't have income, or if they're a pensioner, or if they're on Social Security, or if they're disabled, then obviously those are special cases. But I think there's a lot of people who use medical services as a convenience because there is no cost involved. People who want to have time off work, they want to consume some of their sick leave. Um, and I'm not, I don't have a lot of specific examples, but I suspect that a lot of the funding for our medical system is consumed with trivial matters.
In my last call there on this subject, I don't know if you heard that piece from Rosemary, but she was saying how administration actually eats up a lot of the costs, that we have like something like it's 1.4, I forget the stat, but compared to Germany, who has approximately the same budget as us, they get a lot more, they get a lot more done with that budget. So I think it's maybe administration is also a big expense.
Yes, I think there needs to be a big cleanup. There needs to be a careful review of how services are delivered and how to get the best bang for the buck. I think the situation we have has decayed over time into a sort of a sloppiness has crept in over the years. And I think it's been dangerous for politicians to be involved because it's a very political issue and it's close to people's hearts. And it's always easier to avoid the potentially inflamed topics as a politician, as a member of parliament. I don't think it'll happen unless we make it an election issue.
Too often, I think it doesn't become an election issue, or it gets punted down to the bottom because, the economy takes priority, or, I mean, I think the pandemic, I guess, in a sense, if there's a silver lining, it is one of the silver linings is that it's really exposed the cracks in the system.
Mm-hmm.
The lack of capacity, how we're running very close to the bone with our medical system. Exactly.
Can you tell us a bit more for those of us who are in Victoria or not in Qualicum Beach? We've heard of Oceanside, so just a bit more about Oceanside. And then another thing I heard is that there was a move afoot, or still is, I'm not sure, because one of the issues, I think, from my understanding, my basic understanding, is that residency positions for newly graduated general practitioners, I think it would be, or family doctors, is sometimes in short supply as well. And there was a move afoot. If Qualicum Beach, through Oceanside, I believe it was, were to sponsor their own residency position. So if communities could actually, I don't know if you folks have seen that movie. The Quebec version was the Ground something or other, but there's a Newfoundland version with Gordon Pinsent, and they're trying to attract a family doctor to a community. And
Yeah, it was
the
a
Grand
comedy.
Seduction.
Yeah.
Yeah. So I mean, tell us about Oceanside and what services it can provide or can't provide, and B, have you heard of this? Like, is it possible for communities? I mean, should it be possible? Because I think it was politics that quashed it in the end, but should it be an option maybe for communities to be able to sponsor, if they want to come up with their own funding to sponsor their own GP to come to the community, or multiple GPs to come to the community? Could that be an option as well?
Oh, I think that would be a great option. And I do remember them talking about it and it getting quashed. I don't remember why it got quashed, but yeah, I thought it was an awesome idea. And we had an empty clinic. So it was just waiting for doctors. I think it's been turned into a different kind of business now, but yeah, no, it would be good. Yeah.
I don't. Yeah, I agree. It would be nice to have the service. I think it's a little dangerous to ask us to pay again for the services we are already paying for. So I have a reservation about having to pay a second time for the same thing. I know that there's a clinic that opened recently, and I think that was in where the previous walk-in clinic was. It's this flower. It opened a week or two ago, and what they did is they took or they selected 2,100 names off the list of people awaiting a GP, and I think they've set it up with a couple of registered nurses, right, who would do
Nurse
initial things.
practitioners.
There you go. Thank you. Nurse practitioners who could do referrals, and they can do, some prescriptions and that sort of thing, which is of course, great for 2,100 people. But and they were talking about later on hoping to get some physicians in there, some family practitioners in there, and I think that probably is the model, given that it's such an unattractive business for a youngster to get into, is to actually create facilities, to create nests for family physicians to land in, where they can do their work without having to inherit all the headaches of actually running a clinic. The second part of that question, I can't speak very authoritatively about the Oceanside Urgent Care Center. I've been there only a couple of times, and I've been there for imaging. So as far as I know, they have a sort of a reception, and they have basically what looks like an emergency department of a hospital. And they have a few physicians that then work their way through the list. So you take a number, you tell them what the problem is, you take a seat, and they'll call you up, and you'll see a physician. So while they tell you that it's not a walk-in clinic, it's for urgent care only, I think I've been on the point of going there when I've waited I've waited too long for other services and saying, well, it's my only choice at this stage if I need attention. So that's the idea, is if you cut off your finger and your circular saw, then that's where you go to get stitched up. But they don't really want to have to look in your throat because you say you have a sore throat and you think you might have strep throat. They want you to go somewhere else for that. I think the other thing that the urgent care center offers is, I think that there are some of the doctors, potentially some of the doctors who handle the urgent care stuff, I think they have rooms in the building as well. Because I've seen that there's actually a board saying Dr. such and such is in upstairs in room, 126. And so I think that there are actually consultancies in there, consulting rooms in there. And of course you have, for example, the imaging department where you can go for an X-ray or for an ultrasound, so they do. And I'm guessing that's primarily for the urgent care part of things. If they need to X-ray you in case your arm is broken, they can send you upstairs, get the X-ray, and then treat you for that downstairs. But they also handle referrals for imaging from general practitioners. And I know also that there's a Life Labs in the building. So if you need a blood test, so it's a sort of a centralized medical facility, but with the overt purpose of providing urgent care for accidents and medical and other accidents.
Nurse practitioners was mentioned as well, and I'd like to touch on that. I've heard a bit of chatter about potentially nurse practitioners being a bit of a, I think, stopgap is the word, or a sort of a way to fill that immediate void. And I mean, we've seen it happen in hospitals, for instance, where RNs, registered nurses, sort of used to be the standard, and then it shifted down sort of LPNs with an RN supervisor and licensed practical nurses. And now my understanding is we also have residential care aides and care aides sort of as often now the routine nursing staff, with maybe an LPN to do to maybe do the IV or something, and an RN is sort of like a supervisor on the nursing ward. So ways of sort of cutting costs, because the education, for instance, of the care aide took less time and cost less money than the LPN or the RN. And so with the nurse practitioner option, pharmacies do this as well, right? Where they traditionally, there might have been, say, 3 pharmacists on any given shift, and now they'll have 1 pharmacist and maybe a pharmacy technician, which is registered with the College of Pharmacists, and can sign off on prescriptions and such. So it's, again, and they're only half or a third of the wage as the pharmacist. So is nurse practitioners, for you folks personally, or from folks you've talked to, is that potentially an option, as someone who could maybe do stitches, who could maybe look at an ankle injury, a burn or a cut, things like that?
Absolutely. So they would be triaging the issues, and that way you're reserving the more expensive and the more qualified people for the qualified afflictions. They can focus on the things that require their skills rather than having their time consumed with the more trivial stuff. that can be handled with a referral or with a prescription. Absolutely. I'm very much in favor of that. And they would fulfill a role that telehealth can't, right? Telehealth, you can talk to a doctor, but the doctor cannot examine you, right? If you had a nurse practitioner, you could have let's say you have a mole that you don't trust on your leg. You actually have somebody qualified to take a look at that and make a judgment as to whether it needs attention or not. And I'm guessing a lot of the work that doctors do is reassurance. Is people don't know whether a thing is a problem or not. So they have to be reassured that it's not, or if it potentially is a problem, someone who can direct them to the right place. And I think there's no reason that a nurse practitioner couldn't do a large proportion of that work. And that way we can reserve the scarce doctors for the things that absolutely require a doctor.
Sue, did you have any thoughts?
Sorry, no, not at the moment. I got distracted for a minute. Sorry.
I was just going through an interesting thought experiment as Hans, you were speaking sort of about a nest for newly graduated GPs to land in. I'm just going to put this out there because I do enjoy thought experiments, but I almost wonder if pharmacies being privately run might be an option for, they often have you mentioned consultation rooms at Oceanside, and perhaps pharmacies, where there's maybe some renovations have to be done, but where there's a consultation or exam room, and perhaps they have a nurse practitioner there whose wage is maybe in the area of $30 to $40 an hour. And then if the province is able to pay, a similar fee for service per consult, perhaps $30 per consult, and that nurse practitioner is able to see 4 to 6 people in an hour, and somehow the pharmacy, say London Drugs or Rexall, is sort of the the sponsor of that, so they'd be the recipient of those funds, for instance. So there's an economic feasibility to it, and I mean, how great, you go to sort of a one-stop shop. There's not having to be a clinic built somewhere. She doesn't need an MOA or staff. So maybe just getting more creative with the ways that we create spaces for patients.
I think that's awesome. You're creating a business case for the private sector to address some of the shortfall, right, of doctors. And the other thing is you could even make it a second layer to that, saying that you have to see a nurse practitioner, and they will make an analysis of what the problem is and hopefully address 2/3 or the bulk of the minor issues, and have them be able to refer you to a doctor. So you could then, for every 5 nurse practitioners out there, you could have 2 doctors set up at a premise somewhere, or you could have a traveling doctor, right? I recall in my business life, I worked for a software company, and I recall being at the Rogers Communications head office in Markham in Ontario. And it's a huge building, and they have a food court, and they actually had a walk-in clinic, which was open, a couple hours a day, or 2 days a week or something within the building for their staff. So they would get somebody in for a limited number of hours to address that. So is there any reason you couldn't have a traveling doctor who spends 2 mornings in Qualicum Beach and 2 days in Parksville, and then goes off to Courtney? And so if they get them to cover more area and carefully select or filter the patients that they need to see to the subset that actually require their services.
I like it. I think that is fantastic. We might have just come up with a viable solution there.
Yeah, we've solved the problem. Now we just got to sell it, right?
Well, again, I think loss leader is the business term, but so companies say like Staples or what grocery store do we go to? Save on Food. Cost, they've got certain products that consistently they break even, or they sell at a loss, but in customers coming for that particular product, they're coming for other products. But I feel like healthcare is a loss leader, and there's not really, I mean, like everything at the end of the day comes down to money. I feel, unfortunately, we could debate the philosophy of that, but money is a key issue in the economic model. And I feel like, yeah, billions, if not tens or hundreds of billions, are spent on healthcare in Canada each year, and yet I don't really feel like services have improved, or the system really does feel like it's just in not good shape at all for anyone. And so something's got to give here, like so yeah, more creative models. But it just, healthcare in Canada, as long as it's a universal socialized system, is always just going to be a loss, for the government. Like finding ways to maximize every dollar has to really be considered and maximized.
Agreed. The purse is only so deep, and as the population grows and as the population ages, we have to be smarter about how we spend all those dollars. But as I mentioned earlier, when you're not the customer, when you're the grain that goes through the mill, you have very little power in the system, and that's where we are. I can stand on my head, I can jump up and down, but nobody needs to satisfy me. They need to just keep their billable hours up. Their customer is the government, right? And it's incumbent on the government to institute changes, and the government won't do that, once again, unless we insist that they do. And of course, it's an awkward thing because 6 million or 5 million Canadians don't have a family physician, but the rest of them do. And it's hard to get them motivated to push against this, right? So it's one of those things where the pain only exists for the people who are not getting the services. But nonetheless, if there are 5 million people not getting services, that's a lot more people than there are truckers. And the truckers are certainly getting some attention, aren't they? So maybe it's a question of people getting organized, and I'm not advocating civil unrest or anything, but I think we need to keep pushing our politicians to be looking out for us. And this is certainly, for me, this is one of the biggest points of concern as I retire and get older here, is the lack of medical services, to the point where if it doesn't improve, I would consider leaving and going somewhere else in Canada or to a different country. I've joked with my wife. I waited almost 5 months to get an ultrasound done. And I've joked with my wife that if you parachuted me into Rwanda, I'm pretty sure I could organize to get an ultrasound in less time than it would take me here in Qualicum Beach, which is a pretty dismal situation.
Yeah. I've also been waiting 5 months for an ultrasound. And then my doctor said, well, let's try and get you an MRI instead. And in less than 4 weeks' time, I've got my appointment for an MRI. That's amazing.
But think about it. An MRI and an ultrasound are diagnostic procedures, right? So there's a problem, and they need to diagnose, for an injury, what treatment do you require? Or if it's not an injury, but something else suspicious, they need to determine whether it's something ominous and what treatment may be required. Now, with ominous things, we're always told that early diagnosis and treatment is critical.
Yes.
Right? Now you wait 5 months for an ultrasound to get diagnosed with something ominous that should have been treated 4 months ago, right?
Yeah.
Or you have an injury, you have a muscular or a skeletal injury, you wait 5 months for an ultrasound. By then, so yes, indeed, you ripped a muscle, but now it's kind of too late to do anything about it. I think having diagnostic procedures that take months to perform is only very marginally better than having no diagnostic procedures at all.
Right.
I have family overseas in Turkey, and they have a state system and a private system that run parallel to each other, and it seems fairly good. And my wife and I were there a few years back, and she had some abdominal pain. We weren't sure if it was a foodborne illness or something. So we went to a private hospital, and for I think it was less than $20, I still remember the amount of time. It was 20 minutes. It was 20 minutes
Wow.
from the time that we waited about 10 minutes to see a doctor, and then it was 20 minutes until the time that she got an ultrasound done. So that really sort of opened my eyes to the potential for a private system again to maybe take on a piece, maybe for medical imaging or diagnostics such as Life Labs, because you can pay at Life Labs, out of pocket to have other, diagnostics done. So perhaps something like that. But also, I guess the last question that I would have, because we've sort of touched on it a few times, but we haven't quite taken it head on, is medical tourism. I think that might as well, again, that sort of maybe if there's not a private system in Canada, you had mentioned going down to Bellingham, Hands. I think Mexico is one popular destination. I hear of folks, for the same, like for like something like $5,000, they can fly down to Mexico for 2 or 3 weeks, have a vacation, and get a knee or a hip replacement done at the same time. What are your thoughts on medical tourism?
Can I go back to what you were saying before about when you were in Turkey and your wife got sick? Well, I can tell you that I had a health crisis in August, and I went to Oceanside Urgent Care. They sent me to Nanaimo Emergency Department, and they were expecting me. But I got a CT scan within a couple hours. So urgent and emergencies are treated differently than my knee hurts, and we're going to give you an ultrasound in 5, 6, 7 months. I mean, I still don't have the appointment for that, and it's been about 5 months. So but anyway, I just wanted to tell you that there is a difference between something that's coming on slowly versus I cracked my head open and that kind of thing.
Yeah.
The thing is,
Sue,
go ahead, Hans.
You're absolutely right, Sue. Is that I don't. What I'm saying sounds very negative, and it's not. I think once you're in the system, I think we get top-notch medical care. I think if you go to hospital and you need urgent care, you will be fast-tracked. But once you're in the system, but you have to break through. You've got to get to that point. And that's really my understanding what this discussion is about, is if you don't have a family physician, you don't get a referral. If you don't get a referral, you don't see a specialist. If you don't see a specialist, you don't get a diagnosis. Nobody schedules your surgery. You got to actually have your heart attack before anybody will even treat you seriously. And that's really the the frustration with the system as it stands.
Yeah, I've heard the term sick care. We don't have healthcare in Canada. We have sick care. You have to wait until things are dire before. And again, that's that's a symptom of a system that is sort of in the shape that ours is in. Is only the absolute emergencies are able to be seen. But we've seen a critical crunch point with that now too during the pandemic. Where folks are waiting for ambulances for like 30 minutes or longer, or an hour, or being told, you're better off just jumping in your car or taking a taxi. So even now we're reaching a point where, or you go to ER, we all know stories of folks going to the ER and sitting there for 8 hours. Some people, passing in emergency rooms and things like that, or situation worsening. One final point, Sue, I'll just say too, is that, what Hans was saying, sometimes there might be an innocuous thing like a mole or a lump, something small, and you're not really a complainer, and, you don't want to, you're not sure if it's something, and you can't get the time off work, but you finally do. And you go to your GP and they're not sure, but they'll send you for an ultrasound. And if it takes 5 months to go and see something like that, let's say ends up being cancerous, something that's a small issue, an ounce of prevention is worth a ton of cure. As something that's a small issue might have been dealt with quite quickly had it been diagnosed quickly, but to wait 5 months for an ultrasound, some of these things could have like fatal, so it's sometimes it's not necessarily an emergency, but it might actually be something quite serious too. So yeah.
Absolutely. Good. I think the idea of a universal healthcare system is awesome. I think the system, once you're in the system, the care you get is awesome. I have absolutely no reservations about the people who work in our healthcare system. I just have concerns about the system itself and how difficult it is to actually get access to the services that we've prepaid for over the years.
Yeah,
And that
I
I think
agree.
is in summary, yeah.
Yeah, when you have to wait 18 months for your specialist appointment, that's a bit bad.
Yeah.
Yeah, a bit. But I've done it.
Well,
And then you get in there and the specialist says, well, I can't really help you. We're going to send you to this other doctor. And then you wait another year and like
Yeah.
that.
Yeah, do not pass go, do not collect 200, for the
That's
monopoly
right.
players, right? It's like snakes and ladders, isn't it?
Yeah. And then you end up disabled
Yeah,
because you weren't looked after. Yeah, it
Yeah.
happens a lot.
yeah, yeah, yeah.
yeah.
In the system, I've found, I think you have to advocate for yourself, right? I mean, my wife had a knee replacement a year and a half ago, and she only got it because she refused to be fobbed off any longer. She was actually, we had a disabled, placard for our car because she
Mhm.
could no longer walk across the parking lot and do her shopping and walk back again. And the doctor was happy to say, okay, well, we'll give you a cortisone injection and you can come back in 6 months. And she said, forget it. Right. And then you get prioritized. They have a list. They have a limited number of slots. So you need to make sure that your case is, it qualifies for the slots. Or if you do qualify for the slot, that they know that, the impact of that on your life. I think in our system, if you're quiet, if you don't advocate for yourself, you disappear.
That's a
Right.
great point.
Yeah.
My wife has worked as an MOA previously a few years back, and for a good number of years, and she sort of is a very strong advocate for herself and for her friends and family, and so she got her father in to get a procedure done, and by really pushing, and she's really brought me on to that side as well, that you really have to be a squeaky wheel in the system too. And again, that's another symptom of a system that doesn't have the capacity to see everybody equally in an efficient manner. It's you really have to be your own advocate. Yeah. All right. Any final thoughts or commentary or questions to put out to policymakers or on the subject?
I
Not off
think
the
I've
top of my
said,
head.
yeah, I think I've said what I need to say. I think, like I say, I think the people in the system are great. I think the system itself is way, way overdue for a good rationalization of how it all hangs together. I think we need some efficiency experts to actually go in there. Maybe even private enterprise people. It's go in there, get some consultants in, and determine where is what is your objective? What is your policy? What is your policy statement? What is the system's set of priorities? Then take a look at where is all the money going, and then develop a plan on how to realign the funding of the system based on the priority list that should exist for that system. I think that over time, things have just got sloppy to where more and more money has gone into it, and it's been absorbed. That money is never returned. It always is absorbed, but it's not absorbed in the places where it needs to be. So someone needs to look at this thing with fresh eyes and clean it up and straighten it out for the 21st century.
Sue and Hans, I couldn't have asked for better guests. Honestly, what a great discussion. And I'm sure our viewers, our audience will feel the same way. And we touched on a lot of important issues. And I hope to, send the link to this episode to some policymakers. I think there were some really good points raised, and maybe it gets some more folks talking, as you said, to get more pressure for the upcoming elections, to really make this, to force this issue for all of us, who don't have a family doctor or who aren't content with their family doctor, or who want more options in healthcare, to really start to be more vocal about that.
Super. Thank you, Adrian,
Great.
for
Thank
setting
you
it
so
up.
Thank
much.
you.
And take
Thank
care
you.
and best of health. And yeah, thanks again.
Okay.
And to you. Thank you.
Bye.